the annual award to go towards this initiative. This goal aligns with the Make Rural America Healthy Again goal. And then this is the one that has all of those buckets that I was talking about that crosses over several of them: prevention, chronic disease, mental health and substance use disorder, appropriate care availability, and innovative care. This bucket, we want to, again, support evidence-based, outcomes-driven health initiatives that are focused on prevention, chronic disease management, behavioral health, and prenatal care in rural Nevada. This one, again, will be awarded through a competitive procurement process, which will include that evaluation committee. And here we've given some ideas on potential priority, which may be given to different proposals that address these different factors. So, establishing new access points, implementing preventative care programs, ensuring that they demonstrate measurable health outcomes and program sustainability, and of course, community engagement, because we can't do any of this without engagement of the community. And then lastly, also to explore multi-payer value-based care frameworks to really, try and reward improved outcomes and efficiency in the healthcare system. And then here I wanted to highlight how our 4 initiatives do align with the governor's 3-year plan, specifically under health and wellness. So each of these 4 initiatives, obviously number 3.1, attracting talent to address healthcare workforce shortages, aligns very well with our first initiative of rural healthcare access and provider recruitment, to really, grow that training and, reward the retention there. And then 3.2, improving access to primary care and public health services. So we feel that, we, again, that, number 1, the rural healthcare access and provider recruitment really supports that main goal of the governor to improve the access to primary care, obviously. And then additionally, talking about the loan forgiveness and reimbursement programs that we talked about with that first initiative. Number 3.3, reducing dependency on social services. So, looking to deploy those new mental health investments that we talked about potentially with initiative number 4, the Rural Health Outcomes Accelerator, and enhancing programs supporting transitions to work. So, talking about the upfront tuition payments for employees already working in a critical access hospital to pursue higher level degrees. And then 3.4, ensuring veterans have access to appropriate services. So the Nevada Health Authority has been in conversation with the Nevada Veterans Association and do, want to ensure that our application and proposals do assist in coordinating those services for veterans between state departments. So anything we can do to assist in that collaboration, we're definitely open to. And lastly, improving healthcare quality metrics and outcomes. All 4 of these initiatives will be tied to several quality metrics and outcomes. So very heavily much does support that initiative of the governor, and supporting build out of healthcare infrastructure. So we talked about that in initiative number 2, the rural number 3, the Flex Fund to strengthen rural health infrastructure. And then obviously recognizing healthcare build out as an economic development. All right, and then summarizing here our next steps. So as I noted on the last public workshop, we had about 30 days to draft and finalize our application to submit to CMS. And the awards have to be announced no later than December 31st. We are planning to release an executive summary of how the state plans to address our application, detailing out these 4 initiatives this week. So we don't have that today, but we will have it this week, and we will put it out on our listserv and be sure to make the wide announcement. And then also anything else that the state plans to put forward for the application or anything related to the rural health transformation program, such as looking for applicants to apply to to serve on the steering committee will be sent out through the Nevada Health Authority listserv. So please be sure that you're signed up for that so that you don't miss anything. And with that, I think I'm going to pause for questions. So I'd like to open it up for questions. If you guys want to utilize the raise hand feature in the Teams platform, that would be great. And Alicia, if you could put in the chat maybe the numerical code so that folks on the phone can raise their hand also, that would be great. So I will pause for questions. Please feel free to raise your hand if you have questions. All right, I know I went through that a little fast. There's got to be some questions. Oh no, Jenny Claypool said the listserv on our site doesn't seem to be working. Well, we'll get that working for you, Jenny. I'm sorry about that. All right, we got a hand raised. Okay, Kristen, please go ahead.
Sorry, I was muted. Say, I have a question. So basically the first portion of the award, any state that has a proposal will be awarded the $100 million for 5 years. That's correct, yes?
Yes, that's the baseline funding.
Okay. And so my curiosity is, has there yet been a determination regarding how those funds will be distributed? Like, and maybe you mentioned this and I missed it. My phone rang, I apologize. Like, have you determined, like, will it be a block grant? Will it change between the different initiatives?
So yeah, we will, we're allocating a percentage of the annual awarded funds towards each initiative. And then within those initiatives, there are separate activities that the state would like to propose to utilize those funds. So part of that will be, you know, an RFP process that would result in a contract, or an RFA process that would result in a subgrant. And so those details of, you know, what the state is looking for under each of those initiatives will be detailed in the procurement process that will be announced after the award is awarded.
Thank you very much.
Sure. All right. Next hand, I see Gerald. Gerald, please go ahead.
Yeah, just a question. So for those proposals that you took in over a period of time, aren't any of those specifically being included in the application? Are they all being put back in those buckets and it will be through an RFP, RFA process?
Yeah, great question. Thank you. Yeah, we have reviewed over 90 proposals in this short period of time. So we appreciate everybody who has submitted proposals, and we are utilizing those as we write our project narrative and our budget narrative to give CMS examples of different, you know, ways that the state could pursue that initiative. But the actual proposals, correct, like we're going to wait until the RFP process, the RFA process, to solicit those official proposals and then do official awards after the fact. Right, any other questions?
We have a question from Larry Carlos. Is there a plan to establish sustainability of initiatives after the 5 years?
Yes, great question. Thank you. So that is going to be a requirement of all of the RFPs and the RFAs, is that, you know, the applicant will need to include a sustainability plan so that there are no fiscal cliffs after the end of the 5 years. It's very important for us, and definitely something that we are considering highly. Thank you.
There is another question here from Dr. Alyssa Palmer about what about Nevada going after the additional 25 billion? I don't know if we need more details.
So of the 50, so there's $50 billion available over 5 years to all 50 states, right? So half of that funding is awarded like, if all 50 states applied, that would be 100 billion, no, million, sorry. I'm getting my numbers mixed up. Okay, 100 million to each state annually. The other 50% of those funds, that, you know, that other 25 billion, I think that you're talking about, is awarded based upon how the state scores in the application for different rural factors, technical factors, policy initiatives that the state is putting forward. So there is a very complex scoring system that CMS is using to allocate the other half of the available funds. I hope that helps answer your question. Yeah, Dr. Palmer, please go ahead.
Yes, that did answer my question. And I have an additional question. So if there is money that the Nevada gets, would it fall into those same buckets? Or would there be an opportunity to be able to propose something such as an injury prevention center for the state to reduce injuries throughout the rural areas?
Yeah, thanks, Dr. Palmer. I think that those types of details will be fleshed out a little bit more in our RFP process. So we have several ideas, particularly for Initiative 4, that potentially could fall under.
We have another question from Andrew Alexander. Will any of the data or submissions that you are submitting be publicly available for review?
That is a good question. I'm not sure how CMS publishes all state applications, but I can follow up for you on that one. I apologize, I don't have the answer.
We have another question from Larry Morrissey. I hope I said that right. Have there been considerations for the role of employers, both public and employers like school districts and local governments and private employers in rural communities who, as payers, fund a good percentage of care in the rural communities?
I would be interested to talk through that more with you. I'm going to drop or actually, Alicia, can you put my email in the chat for me? Please feel free to reach out to me and we can talk through that. Thanks. I've got a hand raise of Kathy Triplett.
Hi, thank you. Will the 20% capital expenditure and infrastructure maximum be applied to each application, or will it be applied to the state as a whole?
Sure. So each of the initiatives are basically how Nevada is framing our application to CMS. So whatever funds we get awarded from CMS, 20% of those will be in that bucket, for lack of a better term, for capital investment and infrastructure.
Thank you.
We have another question from Valerie Copy. I'm not sure if I'm saying that right. Is the state allowed to set up a longer term pool for funding to create then further sustainability? I'm thinking in terms of the Fund for Resilient Nevada and other projects.
I'm not sure, a longer term pool. I'm not sure what that, I'm sorry, I'm not understanding the question fully. Yeah, Valerie, if you want to come off mute and just elaborate for me, that'd be great.
My apologies. I'm also sick, so that may not have made any sense whatsoever. But I was wondering, so with other large pots of funding that we've received, such as like the opioid settlement dollars, we've set aside funds at the state level, such as like the Fund for Resilient Nevada, where we have this more sustainable pot of funding that we're allowing to collect interest. Are we allowed to do something like that where we can have an account that can collect interest and use that for further sustainability?
On federal grant awards, I'm not 100% certain on that one, but I will check. I've got another hand raised from Janice.
Hi, I'm with the College of Southern Nevada, and
Oh,
I was wondering
hot, hot,
if
hot, 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 hot.
is there an opportunity for, say, institutions to collaborate? I mean, we have a lot of rural areas in Southern Nevada as well as in Northern Nevada. Could we partner as institutions to develop an RFP to support both areas, or does that matter?
Yeah, I would say collaboration is highly encouraged. So yes, please do.
Okay, thank you.
Thank you. Right. Any other questions? Oh, I've got one, I think.
I do see one from Vinay Kamanduri. Does the state have the authority or priority to expand care delivery and teleconsultation by leveraging wearables such as health trackers, CGMs, and other chronic disease monitors?
Yeah, great question. Thanks for asking. So I think that that would fall in line with our initiative number 2, most likely, as well as initiative 4. So stay tuned for details on those RFPs that will be released as soon as we are awarded the funds. I'm not going to say the other. So yes. Yeah, Dr. Palmer. So what is the timeline the state is thinking about for putting out RFPs? So we're anticipating CMS to award the funds by December 31st. And then I've seen that the funds will be released early January to awarded states. So the state is looking to do things as quickly as possible and get ramping up on everything as soon as we possibly can. So I would say stay tuned for messages from the Nevada Health Authority listserv in your inbox to kind of detail out when we think that we would be starting the RFP process, but I can tell you it's going to be quick as soon as possible. So yeah, happy to do that with you guys. I think we probably reached the end of the questions unless anybody wants to jump on really fast before we end. All right, guys. Well, I really appreciate your time today. Thank you so much. And please feel free to reach out to me with any additional questions you might have. We will be having a shared email box that we just don't have live yet. But again, we'll send it out on the listserv once we do. But we are developing a email address specifically for the Rural Health Transformation Program so that we can stay well connected with you all and be sure to share updates as soon as we can. So thank you guys so much. Really appreciate your time. Have a great rest of your day. Thank you.
Thank you all.
Thank you.